Anybody use herbs? They're powerful, super powerful. Many times we think that we need to use pharmaceuticals. But again, as we mentioned last night, how long has this earth been around? 6,000 years. And the use of pharmaceuticals has been just a short period of that time. And the majority of that time, our kinfolk used just herbs. I'd like to look at some of the herbs today and look at the medicinal benefit. Move this over and see a little bit better. No. And who puts up food? Anybody put food up? Well, you can put your herbs up. And there's different ways you can put your herbs up. You can dry them and put them up. They've got about a 6 to 12 month lifespan. You can make an extract out of them. And with an extract, you'll use like vegetable glycerin and water, or distilled water. And the ratio is no less than 65% extract versus your distilled water. A lot of folks will do 2/3 extract, 2/3 glycerin, and 1/3 of the water. If you're below 65%, you can have pathogen growth. So you want to stay at least at that 66%. And there's a lot of people out there would stay a little more on the cautious side, and so they do a 70-30. The challenge with 70-30, it's just a little sweeter. Glycerin's sweet, and so it's a little sweeter in taste. And as I mentioned, the extract, it's good for year and a half to maybe 2.5 years. And then you can make a tincture. I prefer not to use a tincture because that uses alcohol. And that's the difference in an extract and a tincture, is the tincture has alcohol and the extract has glycerin. And the alcohol will pull more material, the chemicals out of the phytochemicals out of plant material. And it will last longer, 3.5, 4 years. But I use a secret ingredient that I believe makes mine last a little longer and make it stronger. What do you think it is? Prayer. Yes, prayer. I believe that God will bless us, if we do what He wants. I just don't think He wants us using alcohol. Plus, I can't see myself walking into a liquor store getting a bottle of vodka. Or where I live, they use moonshine for their tinctures. And then you can use essential oils. And essential oils, I call them herbs on steroids. They're powerful. 1 drop of peppermint essential oil, you'd have to drink 24 cups, it's 28 cups they've now found. 28 cups of peppermint tea. 1 drop of pure peppermint essential oil. You have to drink 28 cups of peppermint tea. So it's extremely powerful. The negative thing I find about essential oils is there's not a lot of herbs in essential oils. I'd love to have wild lettuce. I'd love to have hawthornberry. I'd love to have mullein. I'd love to have corn silk. And so you just don't have some of those herbs available in extracts, or essential oils. What do you look for when you get herbs? If you can grow them, that's good. If you want the best of the herbs, you want it where it grows the best. Where does that herb grow the best in the world that has the most nutrition? And the example I use is kudzu. Do y'all know what kudzu is? Who's lived in the South? We have plenty of kudzu. It grows the best in the world in the southeast United States. China, Japan, Indonesia, all those guys over there would love to have the kudzu that we have in the South. And I think we're rather stupid because we don't use it like we should, because they use it a lot. And here we have the best in the world in our own yards. My Station 2 down in Hartford, literally I have to keep cutting the kudzu ready to take over the building. It grows at this time of year. Right now, kudzu grows in the South 1 foot a day. 1 foot a day. So it's constant work. keeping the kudzu off once it gets going. Kudzu has roots that are 30 to 50 feet deep. That's why farmers will use it for feeding their cattle, because the droughts do not affect it as it does hay. And you just can't mow it up in baler like you can hay. But the plain people, y'all have plain people up here? Amish, Mennonites?
Yep.
They'll use the kudzu for feeding their livestock. But it's very, very valuable. So, yes?
Can you describe what it is specifically?
Kudzu is a plant. It's a legume. It's even more nutritious than alfalfa. It came to America during the World's Fair. The Japanese brought it over when the World's Fair was in Chicago in the 1880s, I believe it was, the late 1880s. And the United States government started paying farmers to use it for soil erosion, to prevent soil erosion. But it just gets out of hand. Now in places it's illegal to even plant it because it's such a problem.
Could there be another name it goes by in another area?
The Asians pronounce it kazoo.
How do you spell it? That was great.
Oh boy, Kudzue or ZU. I can't spell. I spell like I talk, so it doesn't work. I took phonics in school, but it's just kudzu. You can take the plant. Mary Lou's made kudzu spinach. Kudzu lasagna. You cook it like spinach. You can cook it like spinach. It doesn't taste like spinach. It's a different taste. It's an acquired taste. But if you're hungry, it'll work real well. And so when folks don't have food, I'm glad to have kudzu, because people don't like kudzu. I don't know why. They're scared of it. They don't even want to walk in it because it grows so fast and they're kind of scared of it. And it grows very rapidly. And you take that distal 1 foot, and that's the best leaves to use. It's the most tender leaves. That's what grew over the last 24 hours. And you take that end and you strip it off with your fingers. And you can chew it. And some farmers will chew it when they take a rest from working in their fields. And it has kind of an asparagus taste. But the Asians will cut that last distal 1 foot and cook it like noodles. And it's like a spaghetti noodle. In China, if you're an Asian woman, you get up in the morning and you bring a pot of water to boil. You stick your chicken in there and you stick a big old root of kudzu in there, and the nutrients in there are very good for nutrition for the family. If they can't figure out what's wrong with you, the Chinese doctors, and they've exhausted, what they'll do is they will put you on a kudzu diet for 30 days. And what they do is they take the kudzu and they dig it up and they dry it, the root, and then they pulverize it to a powder, and then they'll make a gruel out of it, like a real thick oatmeal gruel. And that's all you eat, a bowl of that every meal for 30 days. They found that they cure gonorrhea, lung disease, tuberculosis, just all kinds of disease that they've been able to cure with kudzu. I have ladies that come in and they want their husband to quit drinking. And so they'll get them a bottle of multivitamins and they'll pour them out. And then they'll get a bottle of kudzu capsules from me and they'll fill it up. And they'll say, "Here, hubby, here's your multivitamins." Kudzu reduces the desire for alcohol. Clinical trials show 40 to 60%. So it's good for alcohol, reducing alcohol consumption. Tinnitus. You've heard of tinnitus, ringing in the ears. That's a very difficult one. And the best research I have seen on tinnitus in this country through National Institute of Health, they took a kudzu IV and gave the patient kudzu IV, and it was very, very effective. The problem is, where do you find kudzu IV, and where do you find a doctor who's going to give kudzu IV? So that doesn't work. Now, when I was in Africa 2 years ago, I met this lady that said there were some herbs in Rwanda that is very, very effective in, and maybe you ladies can help me, that would work for tinnitus. And they told me the name from there. She did. Well, I didn't know the name, and I didn't get back to her to write it down to try to figure out what it was. When I went back again, I didn't find the lady. But she claimed that tinnitus is not a hard thing to cure in Rwanda because they have an herb that will take it out. So God's given us herbs and to use for different items. Well, let's start looking at some herbs here. You were going to say something back. I think you were going to say something.
You answered my question.
Okay. It's kind of like up here. How many of y'all how many of y'all ladies cook with cooked stinging nettle? See, stinging nettle? See, down home, we don't use stinging nettle for food. But when I come up here in northern Wisconsin, I find that y'all ladies collect stinging nettle and make soups and stews and cook it. Stinging nettle is now considered probably the most nutritious of all herbs in North America. Super, super valuable in nutrients. It's a very good source of calcium. We use it. It's my favorite to use on blown adrenals. We use it a lot for female hormones. It's my favorite for allergies down south. I don't know how it is up here to use for allergies, but in the southeast, it's a great tool that helps a person to build up a resistance against allergies that float in the air, pollen and things like that. Men will use it for hair color. Mary Lou keeps telling me I need to use it every day. She doesn't like my mustache turning white. She said it makes her feel old. But men will tell me that their hair color comes back to the normal color after using around 6 months. I haven't had ladies tell me that, but men will tell me that. But I mentioned calcium. It's a very, very good source of calcium. Remember, I learned at Cornell that dairy has calcium. Are we told that? Yes. But at Cornell they taught us, let's say a glass of milk has 300 milligrams of calcium. But what they failed to tell us was it takes more for a glass of 300 milligrams of calcium. It takes more than 300 milligrams of calcium to break down the casein. And so you therefore have a net loss. So actually dairy, milk, cheese, ice cream, you actually lose calcium, not gain calcium in consumption of dairy is one of the problems. The other is, and I grew up on a dairy farm. And at Cornell we learned, and I'm quoting now, diseases of affluence. Dairy is the most significant chemical carcinogen ever discovered. Dairy is the most significant chemical carcinogen ever discovered. And that's what our family provided people. The most significant chemical carcinogen ever discovered. We also learned at Cornell that dairy will increase a child's risk of type 1 diabetes by 1,100%. So cow's milk's not the best for us. We're not cows. Cows is meant for calves. And so it's not as good. So your calcium, green leafy vegetables, your kale, your collards, and nettle. So let's look at some herbs. I won't get real deep into it. I'll get alfalfa. How many of y'all use alfalfa? Sure, y'all farmers. Alfalfa. You stick you a bale of alfalfa out there and stick you a bale of fescue out there, where they're going to go eat? Those goats, cows, horses, they're smart. They'll go to the good stuff. I think they're smarter than us sometimes. Alfalfa, you can use a whole flowering plant, or you can use the germinating seeds. I won't get into the effects, but I will get into uses. It's an antioxidant. It's good for asthma. It's good for the bladder function. It's good for hot flashes. It increases breast milk. So if we have a young lady that comes in or that is trying to lactate, one of the items that we can use is alfalfa. I'd rather use fenugreek. Fenugreek works better. It's powerful. Mary Lou has women come in that adopt, and she's able to get them to breastfeed. And they told us that that could happen back at school when I was back in school and took physiology. But just the sucking aspect can cause lactation. But the herbs really make the difference. And we have some girls that come in, they just don't produce enough, and so we use the fenugreek. But alfalfa is another great tool. So if you've got milk cows, what's a good hay to use? Alfalfa. Because that helps the old bossy to provide more milk. Increases urine flow, so it's a diuretic. It's good for inflammation, so it's a good tool to use for arthritis. My mom had rheumatoid arthritis. We had to move to Florida when I was a boy because she spent very little time at work, mostly in bed with a lot of pain. And the doctor told us we either had to go to Arizona or Florida. We went to Florida. And then she found Dad was a farmer, so he experimented a lot. And so he found that alfalfa was anti-inflammatory. And when she would take large doses of alfalfa, she found that it was significant in reducing the inflammation. Kidney stones, kidney function, lowers blood pressure. Now, why do you think it lowers blood pressure? It's a diuretic. So remember in 2000 when we started it was recommended as a pharmaceutical for hypertension to use a diuretic. Why? Because it's through urination you get rid of sodium. And so you're not able to get that patient change their diet and eat that high salt diet. So you just give them a drug that makes them urinate, which is through urination you're able to pull that sodium down. It lowers blood sugar, lowers cholesterol. It's good for menopause. So you're seeing a lot of hormone issue here. Metabolic health, night sweats, again hormones, osteoarthritis, prostate, and hormones also affect prostate. That's why we don't use red clover for breast cancer, uterine cancer, and prostate cancer, because estrogen can affect those. Protects the DNA. We need that right now, don't we? Maybe we don't. We all do, but maybe there's some people really need to be taking it right now. Rheumatoid arthritis, and that's what Mom had. Tooth decay, upset stomach, uric acid retention. So uric acid retention. So it's good for that. So what would it be good for? Gout. Whooping cough or chronic weakness. Well, it's just alfalfa is packed full of nutrients. And when Dad would grow alfalfa and then plow it under, he'd have to catch a gear lower to plow under alfalfa where we lived up on the mountain, because the root structure was just so good where it was pulling those nutrients out of the ground. Precautions may reactivate lupus symptoms, may cause uterine stimulation or contractions. So we want to use it for lactation. And so I had a doctor come in one time. Mary Lou had helped his wife. She wasn't hardly producing any breast milk. And so she encouraged her to start taking some herbs. And she became a Holstein. I mean, that lady was producing. And she had to cut back. So the next time she got pregnant, the doctor came and he wanted to start taking stuff early. Well, is there a problem? Could cause uterine contractions. Some of those herbs that cause lactation. So you got to be careful there and know what you're dealing with. So either use the ones that don't cause uterine contraction, or wait till right when it's about time for that baby to be born, and then you can start. And if it does come a little early, it's okay, as long as you're in your time frame. Astragalus. Who's ever used astragalus? Astragalus is good. It's the root. It's good for the adrenals. Again, adrenals. Female hormones, adrenal issues. Many times, female hormone issues are adrenal issues. Fibromyalgia, adrenal issues. Fix the adrenals, many times fibromyalgia goes away. What blows adrenals? Stress is big. Stress is major in blowing our adrenals. It's good for aging problems. It's good for cardiovascular system. Cardiovascular, that means heart and vessels. This is the one I get a lot of calls on. Tell me something, my family member, so-and-so, themselves or whatever, they're having problems with nauseousness or side effects of chemotherapy. So this is what I recommend for them, astragalus, because it can help with side effects from the chemotherapy. It does not contraindicate the chemotherapy. It just helps to deal with the side effects of the chemotherapy. A lot of your physicians, your oncologist will say take no natural, because they don't want it crossing over and messing with it or whatever. It's just they don't know, and so they're saying don't do it because they just don't know. Well, you can use astragalus right along with chemotherapy, and it will not affect the effect of the chemotherapy. But it will help with the side effects. Chronic asthma. And nettle is good for asthma. Why? Because you can, many times your allergies can kick off asthma. It's good for colds, diabetes, the flu. It's good for free radical damage. Herpes simplex 1. It's good for the immune system. So did we see people using the astragalus when they were worried about COVID? Yes. Increases cardiac output. So for a cardiac patient, do you think that would be good? So for a person that has a low EF, ejection fraction, absolutely. It can help that cardiac output of blood. Increases sperm motility, inflammation, kills tumor cells. Astragalus. So you can use that for cancer. So it not only is going to help with the side effect of the chemotherapy, but it also will help with killing the cancer. So it's good for cancer. It's good to lower blood pressure, lowers cortisol. Now, what raises cortisol? Stress. So that person who has that type A personality, that person who's major stressed, it's something that you can use to help lower that cortisol. What's the number one cause of hypertension in the United States? Stress. When you're stressed, when you go into fight or flight, you raise cortisol, you lower potassium. The elevation of cortisol, that lowering of potassium, either one or both, will cause or can cause hypertension. And so this astragalus can help to lower the cortisol. Another great tool to lower cortisol, probably the best tool to use lower cortisol, is exercise. Exercise is phenomenal in lowering cortisol. It lowers triglycerides. It helps with memory, so that's another reason we need to take that every day. Prevents plaque buildup. Regulates calcium homeostasis in the heart. That's very important. Another great one for calcium in the cardiovascular system is K2. And I had a hypothesis that on calcified valves that K2 might work. And it was found that K2 can dissolve calcification on your valves, your mitral valve, your aortic valves. Relieves insulin resistance. It's good for stress, ulcers, increases urination. It's a good vasodilator, and it's also good for wound healing. So can you see a benefit in taking astragalus? Yes. Precautions. Consider discontinuing prior to an elective surgery, as it may increase the risk of bleeding. Caution should be taken when receiving immunosuppressive therapy, such as transplant patients, due to the immunosuppressing properties. It's not because it's bad for you, it's just because of the drugs that they give, because of the transplant, it can contraindicate those guys, because it builds the immune system. Bilberry. Do they grow here? Bilberries grow here? Okay. Dried leaves or the ripe or dried berries. What are bilberries used for, we think of? Eyesight, yes. And where did we learn that? World War II in England. There was a fighter squadron in England of Brits that that one squadron they were known to get aces very quickly in that squadron, and they found out it's because it was like the Civil War in our neck of the woods. It was on our backyard, and so guys fought in their neck of the woods unless they were out fighting other places. Well, the Brits were fighting near home, and so it was a local mama was bringing food with bilberries in it and sharing it with her son and the other boys, and that's how they found it was good. I had a fella come in he was in it well into his 90s, did not wear glasses, did not have eye problems, and he was an American pilot, and the Americans learned from the British Air Force the benefit of using bilberry, and he said that the American pilots started using bilberry, and so he used it his whole life, and he was 90-some years old, and his eyesight was fine. Uses: atherosclerosis, that's clogged arteries, bladder stones, bloating, cataracts. You'll see bilberries in numerous areas for eyes. Diabetic retinopathy. It's good for diarrhea. Dysentery, again, eye problems in general. Gastric ulcers, hemorrhoids, blood circulation, kidney function, myopia, and that's eye problems. Night blindness, again, eyes. Platelet aggregation, Raynaud's disease. Now, who knows what Raynaud's disease is? We see ladies in the summertime wearing gloves because they have poor circulation. And so women you can use bilberries, and so they need vasodilation. And so just like men will use yohimbe, who's heard of yohimbe? Men use it for ED. Well, women use yohimbe for Raynaud's disease because it's a vasodilator. Scurvy, ulcers, varicose veins, it's a vasoprotective. Venous insufficiency, so that makes sense, venous insufficiency along with Raynaud's, because Raynaud's is venous insufficiency. It's also used for wounds. Precautions: do not use leaves longer than 3 weeks at a time. I've never used the leaves, I've only just used the berries. Leaves lower blood sugar levels. Now listen to this, see if y'all can pick this up. Now how many of y'all know what the PDR, Physician's Desk Reference is? Okay, that's what the docs and nurses and folks use for prescription medication. Well, the same company that makes the PDR for medication make a PDR, Physician's Desk Reference, for herbal medicine. And so this information is coming out of the PDR. Now this is their minds. PDR is very related to FDA and thought. So see if you can pick this out. The leaves lower blood sugar levels. So insulin-dependent diabetics should not take them. Take them infusion without professional guidance. So what's happening? The leaves lower the blood sugar. Now, is that a good thing or a bad thing? So why are they saying not to use it? It may get too low using the same volume of drugs. And they're not going to tell you to cut back on the drugs. Do you see the thinking there? Yes. Yes, ma'am.
It's a vasodilator, so could one of the side effects be that it can exacerbate migraine symptoms?
I can't answer that. I don't have experience with that, so I don't know. Yes?
I would typically say that migraine is more of a restriction of the blood vessels than would be.
It's usually the opposite. It's usually the opposite, because if you get a person with a migraine, you put an ice cloth on their head to cause vasoconstriction.
Yeah.
So I
the
can't.
medicines that the doctor will give you
Yeah.
will constrict the vessels.
That's right.
To give you relief.
So I can't. I don't. If a person has migraines, that could be something that could be a contraindication with a person that had migraines. That's possible. Yes. So it'd be cayenne pepper. Because if cayenne pepper is a vasodilator. We use it, it works actually, sometimes people find it better than nitro. Works very good. If you have I had a guy one time, we were in a class, and it's really neat to see physicians grasping natural. And we were in a class learning, and one of the participants was out of Texas, and he came up to me and he says, "Can you check my blood pressure? It feels a little high." So I checked it, and it was 220 something, high 220s over, I forgot what the diastolic was, but it was high, 130s, 140s. And he looked like, looked fine. I said, "Is this normal for you?" He goes, "Yeah, it's normal to be that high for me." I said, "Well, it's not good for you." So I called over one of the guys that was in the class. He was internal medicine. I said, "Double check this. I just want to make sure I didn't take this blood pressure wrong." And he checked it, and he goes, "Well, yeah, it's right." And he looked at the fellow and was asking him questions, and he said, he said, "Get me some cayenne pepper and a butter knife." And he took the tip of that butter knife and took a nice good chunk of it and told him to open his mouth and dumped it under his tongue. And it came down to, the systolic came into the 180s. I don't remember what the systolic did. I don't remember what the diastolic did. And he said, "Let's do some more." So he gets some more and stuck it under the fellow's tongue. And it came right on down. It's hydraulics. If you have a pipe and you have a certain volume of fluids, and if you make the pipe bigger with the same volume of fluids, the pressure is going to go down. If you make the pipe smaller with the same volume of fluids, it's going to make the pressure go up. It's just hydraulics. Black cohosh. What do we think about black cohosh for? Hormones, yes. Fresh or dried root. It's a sedative. Here we go. Let's see here. Analgesic, antidepressant, anti-inflammatory, anti-rheumatic, antispasmodic, I have a hard time with that word.
Venomous?
Yep, venomous. There you go. Antivenomous. It's a diaphoretic. It's a diuretic. It's a expectorant. It's hormonal. It's a nervine. It's a oxytocin. It's a sedative, and it's a uterine stimulant. That's why we see it used. Now, it's a uterine stimulant. Had this girl come in one time, and she says, "I've had enough. I want it out now." Maybe some of y'all been there. So she wanted black cohosh and blue cohosh, and she was going to drink a quart each. I said, "Young lady, you can't do that." She says, "Yes, I can." I said, "Hold on a minute," because she wasn't listening to me. So I called a real good friend of mine, Kathy Davies. Anybody know Kathy? Y'all enjoy her. They're just a great family, the Davies family. And Tim would fit in perfect with you fellows, and Kathy would with you ladies. And she's a midwife, and I don't know how many babies, but a mess of them. She's delivered 2 of my grandkids, and 2 or 3 of my grandkids. And so I got Kathy on the phone. I said, "Kathy, talk to this girl before she kills herself." And so Kathy got on the phone, and she told the girl how to do it cautiously. But you have to be careful. Okay, uses: blood circulation, bronchitis, epilepsy, fertility, hot flashes, inflammation, kidneys, liver, lowers blood pressure. It's good for the lymph system, malaria, menopausal symptoms, mucus, muscle pain or muscular pain, nervous disorders, osteoporosis, peripheral circulation. Peripheral circulation. What's peripheral? Out here. So it helps in the circulation out here. Harvard was saying just as of late that dehydration causes poor peripheral circulation. Therefore, you have poor peripheral nutrition because it is water that's the train car that carries nutrients. And so how do you fix that peripheral circulation? drink water. Good job, good job. You didn't say black cohosh. See, where I come from, they say, well, take black cohosh. I didn't take care of it. No, drink your water. Then if that doesn't work, then take the black cohosh. Good job. It can be used for ringing in the ears, but we haven't seen it as a big bat. Something that really works. Spasms, uterine problems, it's a vasodilator, also yellow fever. Precautions, not to be taken during early pregnancy. Why? Uterine contractions. Can be used in the final weeks of pregnancy to ease or induce labor, but only under the supervision of an experienced midwife or herbalist. Large doses can produce vertigo, tremors, low pulse, vomiting, nervous system irritation, headaches at the base of the skull. Black walnut. What do you think about using black walnut? What do we use black walnut for? Parasites and worms. Yes. It's the black walnut hull is what you're using. You're using the hulls. Well, that's what I use. Bark, leaves, nut, hulls. But for parasites, I use the hulls. Abscesses, acne, athlete's foot, blood sugar, boils, cancer. Now let's look here. Let's look in here. Abscesses. Abscesses are a blood problem. Skin issues are blood problems. So this must be cleaning up the blood. Acne is a blood problem, and so you use a blood cleaner for acne. Boils. Boils are a blood problem, and so you use a blood cleanser to fix boils or boils. Cancer. Anytime you've got an herb that kills cancer, it's usually a blood purifier. Anytime you have a blood purifier, it's probably good for killing cancer. It's used for colitis, diphtheria, eczema. Eczema is a skin issue, therefore it is a blood issue. Fungus, goiters, gum disease, hemorrhoids, herpes. Now here's one to be careful with. It stops lactation. Now why do you think I talk so much about, I bring out the lactation issues? It's because it's a problem we have in America, that we don't have enough breastfeeding. In 1969, Tennessee was the 4th healthiest state in the United States. In 2009, we were the 4th unhealthiest state in the United States. And according to the Department of Health in Nashville, there's 5 major reasons. And one of those top 5 major reasons that Tennessee became so poor in health is we quit breastfeeding. Young girls will tell me, they'll come in, the child will have, let's say they've got colic or croup, and I'll ask, are you breastfeeding? No. Why? Oh, it's gross. That's what they'll say. And the best thing for that baby is get back on mama. That's the best thing for that. And so we have found in our state that if we can get breastfeeding going, we can improve the health of Tennesseans. We know it's good for the immune system. We know it's good for the cardiac system. We know it's good for the gastrointestinal system. There's just so many things that breastfeeding is so important to do. Also, it increases the brain, the IQ of the child is in the breastfeeding. Now, how do we do that? We found that Dr. George Fletch has found y'all young ladies or ladies that have daughters that are in that age or grandmas that have children or grandchildren in childbearing age, and you want to have smart kids or smart grandkids. I've mentioned this here before, but it's worth taking note again to those that haven't been here. Fletch has found that taking iodine, potassium iodide, and potassium iodine, which is Lugol solution, 12 milligrams during the pregnancy, first, second trimester especially, just like you want to make sure you have enough folic acid during the first 2 trimesters. But during the pregnancy, 12.5 milligrams of iodine. And then to breastfeed the child till it's 2 years old, taking 25 milligrams of the iodine. Lugotab, Iodoral, iThoroid are different brands of the pills. I like the Lugotab because it's a time release and it will stay in the system for 12 and a half hours. Research shows that on average the child's IQ is 10 to 15 points above the mother's IQ. Now, fortunately, I had an opportunity to stay with an ambassador in Rwanda. They had just finished writing a book on increasing brain function for children in Rwanda. And he talked about iodine in there, but I was sharing with him, and so he stopped. He was actually getting ready to publish. He stopped, and he called Dr. Fletches and got more of the research and added that in his book. And he's personal friends with President Paul, and the goal is to start implementing that in Rwanda to increase IQ in that country. Now, the Germans found out about this, and they thought, well, what if we go a step higher? Instead of 12.5 milligrams during pregnancy and 25 milligrams during lactation, what if we do 25 milligrams during pregnancy and 50 milligrams during breastfeeding time? And it's early stages, but they're in their early stages finding that their outcomes are even higher than Dr. Fletcher's research. So I'm a big supporter of breastfeeding. Who's done dairy farming? This is off the subject, but let me share with you. This really bothers me. Maybe it'll help you understand where I am on dairy. So I have this couple in the office 2 weeks ago, dairy farmers. And they said, Walt, we don't have to have a bull anymore. I say, AI, artificial insemination? No. So how's the cows start producing milk? They said, we just give them the cow. It would take a heifer and just give them hormones, and they start producing milk. You don't have a bull. You don't have calves. You just give the heifers drugs, and she says you milk them out for 2 years and beef them. Isn't that amazing? And then here's a dairy farmer that's telling me this, and she says, you wonder why our girls are like this? So even more so. See, in 1900, the average cow, according to the United States Department of Agriculture, in 1900, the average cow produced a quart and a half of milk a day. And in 1960, the average cow produced 2 gallons and a quarter a day. And in 1998, the average cow, according to the United States Department of Agriculture, produced 15 gallons of milk a day. So I called my dad, and I said, Dad, what was the numbers in 1960? That's the year I was born. I don't remember. And he said, he thinks, and he goes, he's thinking in pounds and converts it to gallons. And he goes, and I didn't tell him why I was asking. He said, just a little over 2 gallons, right on national average. So I asked a good friend of mine in Virginia. I was in Virginia at the time, Mr. Owens, and he had a 300 head dairy. And I said, Mr. Owens, what were you doing in 1960? He and my dad's the same age. And he thinks back and he goes, just a little over 2 gallons. And this is in 2000 that I asked the question, Mr. Owens, what were you doing just 2 years ago? And he thinks, 1998 when the study was done. He said, just a hair under 20 gallons. Now the average, as y'all know, average is not all, average is an average. You got lower and you got higher. And I said, what is it? He goes, well, it's upbreeding. I said, I'll go with that. We upbred, but no. What, Mr. Owens, what is it? He gets the hormones we give the cows. So why do we see the differences in health in folks? We made fun of the Puerto Ricans back in 2000 because it was affecting boys and girls starting to produce things that they shouldn't have at age 6. Why? We made fun of it because they were giving their chickens hormones and the children were eating chickens. But we're doing it to our folks today and have been doing it for a while. Malaria, lupus, liver congestion, oxygen deficiency in the blood, parasites, internal parasites, pinworms, ringworms, syphilis. But I use it for, one of the things I use for Lyme's. Tapeworms, tuberculosis, valley fever, and worms. Not recommended for long-term use, both internally and externally. Take black walnut orally. At least 1 hour after medications, you may take by mouth. So it's kind of like charcoal. You don't take it real close to the meds. Better yet, not to use the meds if you can. And let me explain that for a moment. Let's see if I can find it real fast. I mentioned it last year, but I want folks to see. Okay. I think this is a healthy approach on pharmaceuticals. That's weird. Okay. When physicians understand physiology in its truest sense, their use of drugs will be very much less. So what's that tell you? When they understand physiology, then they'll use less drugs. Does that make sense? Okay. And finally, they will cease to use them at all, based on their continued education in physiology. Do y'all see that? Okay. The physician who depends on drug medication in his practice shows that he does not understand the delicate machinery, physiology, of the human organism. So, last year, when I came here, Mary Lou was having some breathing issues. I noticed it in March, April. When we were in bed, she would have some fine crackles, and she would have some wheezing, both. Some one or the other, or both. And it was getting worse and worse. So I asked a friend to get a chest x-ray and let's see what's going on inside. I like diagnostics, otherwise you can't see. And so they looked inside and they said, oh, she has COPD, chronic obstructive pulmonary disease. Now, asthma is no longer part of COPD. That went away about 3 or 4 years ago. COPD is now only emphysema and chronic bronchitis. Well, her father was a smoker and smoked like 3 packs a day. And that was our wedding present for him to quit smoking. That was a good wedding present. But she lived all the way up through high school and with a man who smoked 3 packs a day. And so the radiologist says it looks like COPD. The physician said, yep, COPD. So we dealt with lung issues March, April, May, June, July, August, September, October. Just building lung function. What herbs are good for lung function? Mullein, yeah. So we hit the mullein good. We use dandelion and mullein. We use broncholine. Broncholine is excellent for the lungs. But it didn't get better. It just didn't get better. By November, she started having problems going up and down stairs at home, and got to the point she could not go up and down stairs at home. She started having some chest pains. She walked a lot. She could no longer hike. She couldn't walk up a hill. Just walking from the car up to the house was significantly a challenge. So I took her to another friend, a physician. And I said, do some workup on her. See if you can figure out what's wrong with her. Because it's not a lung issue. It's not getting any better. And we should be seeing some improvement. It's more than just a lung issue, I believe. So he looked at her and he says, I think it's probably just that COPD. And then that evening he calls me on the cell phone. He says, Walt, get her back up here. He says, I'm afraid she has what my wife had. And his wife had died 2 years ago, 2 years prior, with heart failure. He said, get her back up here. So I took her back, and the next day he ran all kinds of tests and found that she was in heart failure. And so we went and they did all kinds of testing. And so we went to one cardiologist, went to another cardiologist, and they totally were 180 degrees off. 180 degrees off. Well, that's not good. So I called a world-renowned thoracic surgeon in Southern Cal that developed the machinery and technology that you can be at Mayo Clinic and do heart surgery in Africa. And so I asked him, I said, what do you think? He said, don't at all do what that one fella says, he'd kill her. He said, go to Birmingham. So I said, okay. Went to Birmingham, UAB, University of Alabama at Birmingham. They've got some of the best in the South in cardiologists. I would like to go on to Cleveland Clinic, but my son lives in Birmingham, so it works a little bit better. They went in and they looked inside her heart, and they said it was squeaky clean. No plaque buildup at all, period. The only thing they could find with her heart that was wrong with it as a root cause, they found some damage that only one thing causes. It's called the red devil. And they asked, did you use ever adriamycin? Yes, 44 years ago. It's a chemotherapy drug used 44 years ago. And they said, that is what's taken out your heart. They said, we normally see a heart failure after adriamycin within 10 years, but 25 years at the longest. That's the longest they'd ever seen at UAB. Mary Lou is now their longest, 44 years. So he said, so the fellow who is on their advanced cardiac team, he said, your wife is in significant problem. And he says, let me show you her left ventricle. The movement of her left ventricle was like this on the echo. That's all the movement there was. That's it. And her EF was, ejection fraction was 10/15. What do I do? I mean, that's fast. They'd done an echo in Knoxville, and it just 30 days before, and it was a 25/30. In 30 days, it had gone from a 25/30 to a 10/15. You don't play around with that. That's fast. And to see it just barely moving. I said, okay. He says, it's serious. I said, what would you do if it was your wife? He goes, she's going to the hospital right now, and we start drug therapy. I said, okay, let me pray. When you make decisions, you make informed decisions. Yes? So what information did I use to make a decision? Yes, I've had a number of physiology classes, worked in healthcare, but I had this information. See, it says when you understand physiology, you'll use less and less medication until you use none at all. I was doing what I understood, but she was about to die. And so, if you've gone as far as your understanding of physiology at that point, and they're about to die, it still gives room to use the medication. Do you see that? Do y'all see that? So I said, okay, let's do the medication. They were only able to do 2. They wanted to do 7 meds. But because she was healthy, all of them have a problem of lowering blood pressure. And they were only able to give her just 25% dose of 2 meds, which is hardly anything. And they said that her chances of keeping that heart was only 12.5%. That we were probably looking at a transplant. So okay. So they put her on the advanced cardiac unit. They put her on the heart transplant unit and monitored just 25% of those meds for almost a week. Put her on a life vest, which is like a defibrillator, and sent her home. Now I know what I'm dealing with. It's a heart issue. Let's get aggressive. So we got aggressive with herbs. And I took her back 3 weeks ago, and her EF is back up to 25/30. She also had, her mitral valve had significant backflush. Her left ventricle had significant enlargement and failure, and her right ventricle had significant failure, and her AV node was not firing at times. So we've got a lot of problems here. So what do we do? So 3 weeks ago, her left ventricle had shrunk, therefore allowing the leaflets to start working better, and so she now has only moderate mitral valve backflush. She had no PVCs, but she was running 50% of the time PVCs. So did we see improvement?
Yeah.
Absolutely we did. Whether those meds helped or not, I don't know. All I know is God's helping to heal her. So why do I tell you Mary Lou's story? It's because I had to take a decision based on this right here. And for me, this right here is a promise that we can get to the point that we don't have to use medications. But we need to understand physiology to do that. Diabetes. In type 2 diabetes, we learn how to reverse type 2 diabetes without medication. It's simple. It's easy. Type 1, we haven't figured it out. Yes, we can get type 1 down from, say, 60, 80 units of insulin down to 5 units of insulin pretty easy. But to plumb get rid of the insulin on a type 1, haven't figured it out yet. Yes, there's some programs out there like Dr. Cousins who's doing a whole food plant-based diet and he's seen some benefits. But overall, we haven't. And to just say, nope, no more insulin for a type 1 diabetic. Is that going to be dangerous? It is. So you have to, so our goal is here is to understand physiology. And then use those naturals with that physiology. And that's what we're talking about today as we're looking at these herbs. Bone set. You can use the leaf, you can use the flower. Uses: arthritic pain, arthritis pain, bronchitis, cough, cholera, colds, constipation, encephalitis, fevers, fever treatment, flu, indigestion, inflammation, loss of appetite, malaria, measles, mucus buildup in the lungs, mumps, rheumatism, Rocky Mountain spotted fever, scarlet fever, stimulates white blood count. What would that be good for?
Immune system.
That's right, cancer. Sweat inducer, tones inflamed tissue, typhoid fever, viral infections. So what would that be good for? Coronavirus. Worms, yellow fever. Contraindications. According to the PDR, health risks or side effects following proper administration of designated therapeutic doses are not recorded. Now let's go back. Look at all these health problems. Find me a drug that will deal with all that and not have any side effects. Isn't God good? You want to go to the F-A-R-M-A-C-Y. You got it? F-A-R-M-A-C-Y. Burdock. Does burdock grow up here?
Yes.
Okay. Burdock. It grows in our mountains too. It's an old mountain remedy for us. The root, the seeds, the leaves. What do folks use here? The root?
Seeds.
Use the seeds also?
Seeds mainly.
Who said the seeds? Okay. How do they use the seeds? We just use the roots.
Well, I made a tincture or an extract out of it.
Mm-hmm.
Yeah.
Okay.
So you could use it by drop first.
Okay. Yeah. We've only used the roots where we are. That's good to know. Okay. I mean, we've seen it, but that's just what we use where we are. Abscess, you look at the effects. Antibacterial, anti-inflammatory. I mean, just look at all the good stuff. Blood purifier. So it tells you if it's a blood purifier, it is anti-tumor, anti-cancer. So it's one of the items I use for cancer. It's probably the second herb that I use for cancer. I use Padiarco first, then I'll use burdock. First of all, we pray and ask God which ones to use, but many times that's what we're attacking. Sometimes we don't. We use something different. Abscesses. It's an antidote for certain acute poisonings, arthritis, blood acidity, blood cleansing. Again, you see that blood cleansing and cancer going together there. It's for cough, So if you have a person that has a problem with a cough, the burdoc's good for that. If it's a chronic cough and it's not a real productive, or do you know how some folks, they cough all night long and they can't sleep and it's really not productive? What you can do is use, I don't want to just plumb stop coughing. There's a reason they're coughing. They need to get something up. But let them cough in the daytime, and at nighttime you can use lobelia. Or as the mountain people say, lobelia. Y'all have lobelia here? Okay. Yes?
I think it might be here, but just sometimes we don't know how to recognize it.
Okay, it's got the leaves, it's got a little flower, looks like a trumpet, and it's purple in color. Yeah. And so you can use lobelia, and usually 30 drops is an adult dose in an extract, and it will stop the coughing. So it's an antispasmodic in low doses. In high doses, it's a spasmodic and works like Ipecac. And so you don't want to give too much or they'll throw up. We use as a bile duct dilator. It dilates the bile duct if we're doing a gallbladder cleanse and we're wanting to get rid of gallstones. Detoxing, glandular problems, herpes, hormone balancing, iron deficiencies, kidney function. What's good for iron deficiencies? Do y'all do blackstrap molasses up here? Blackstrap molasses is an excellent iron product. A tablespoon twice a day is very, very good for raising the iron. Kidney function, liver purifier, lymphatic system, measles, prolapsed uterus, skin sores, sore throat, swelling, syphilis, tonsillitis, urine flow, no health hazards or side effects known in conjunction with the proper administration and designated therapeutic doses. Now this one's even a bigger one, y'all. Try a cancer drug right there, no side effects. Mary Lou's heart just shut down, almost plumb quit. They were getting ready to put her on a transplant list because of a chemotherapy drug side effect from 44 years ago. And so you look at all these problems. No health hazards. God's good. Now you've got to use it like it's supposed to be used. Butcher's broom. Now time-wise, what's the schedule this afternoon? We've got this, and then we have the digestive system. How late does the afternoon program go?
All day.
Okay, is that this one? And then the 4 o'clock is the next one? Okay, so tell me when to quit. What time?
You got time.
Oh, so what do you want, 15-minute break? But the next one starts at 4? Oh, okay. Well, we're only going to touch about that much. If I went through all of it, we're talking a whole day thing. So we'll just go Yes, I can. Absolutely. So how much longer do you want to go? Give me a time frame. 15 minutes? 30 minutes? It's 3:15. 3:30. Okay, so let me look up some more favorite ones here. Calendula. Who knows what calendula is? Now, highfalutin people say calendulus. But I was listening to Dr. Agatha one time. She said calendula, and I figured she could say calendula. I could too. She was from South Georgia, and so it's just how we say it. You can use the leaves, the flowers, the petals. I use the flowers a lot. Bleeding gums, blood purifier. What do you expect to see across the page? Cancer. Bruises, burns, chicken pox, cholera, cancer, cramps, earaches, fevers, flu, frostbite. Do y'all have that up here? Frostbite. Gangrene, headaches, hemorrhoids, indigestion, inflamed eyes, jaundice, lupus, measles, delayed menstruation, pyorrhea, post-op healing, rashes. It's very good for rashes, skin conditions, scorpion bites, skin injuries, skin irritation. I like it a lot for skin issues. Sprains, stings, works great. My youngest son Carson got stung. We found in this situation he was allergic to bees. At the time I was a beekeeper, and he started swelling over here. He got stung here, started swelling over here. His nose started swelling. I was concerned, so I took him on into the office. And how many of y'all know the Restrepos? Pastor Restrepo, Dr. Restrepo from Colombia, Venezuela? Great people. I mean, he's tremendous. Bring them up here sometime. And that man, he talks real soft. And then as he keeps talking, he crescendos. But I think he does that so you can really pay attention to him and listen to him. But tremendous spiritual teacher. He's a pastor, and then she's a great physician from Colombia. And they had a center in Venezuela. She was doing a locum tenens with us. She put calendula tea on him, and it went right away. Just went right away. Thrush. Now, here we go. Let me come back up here. Stings. Stomach aches, stops bleeding, sunburn, syphilis, thrush. Also, I use both calendula, and I also use Padiarco for thrush. Padiarco is very good for thrush. That's PAU space D apostrophe space ARCO. Padiarco is probably one of my favorite. It's great for prostate. If you're having prostate issues, Padiarco is very, very good in shrinking the prostate. My second one for prostate is black seed oil. Black seed oil. The black ladies put it in their hair. It doesn't work well for white hair, but it works excellent for y'all's hair. I send it. Most of the people who get it are ladies from the Caribbean, and they'll use it in their hair. It makes for our hair. We learned from the Colombians. Mary Lou used coconut oil, and coconut oil works. It's olive oil. Olive oil works very good, but it really makes black ladies' hair really, really pretty, and that's black seed oil. Works very well for prostate. But back to calendula. Thrush, varicose veins. Precautions: avoid if allergic to plants in the ragweed, chamomile, or echinacea family. Because of its promotion of menstruation, pregnant women, breastfeeding women, and women seeking to get pregnant should avoid calendula teas. Calendula can possibly irritate negatively with sedative use, sedatives due to its muscle relaxing abilities, as well as diabetics and blood pressure medications. California poppy. Who's ever heard of California poppy? What do you think of California poppy for? Pain, yes. It's very good for pain. My favorite for pain is wild lettuce, but I also use California poppy. I also use Jamaican dogwood. Jamaican dogwood, California poppy, and wild lettuce. Excellent painkillers. I found that if I'll add skullcap along with it, I was at University of Tennessee with a friend of ours who has breast cancer, bone cancer, and Mary Lou and I were sitting with her, and just to move, she would scream. To use a bedpan, obviously I went out in the hallway and you could hear her down the hall screaming just to use the bedpan. Bone cancer is extremely painful. So I gave her another medication, and pain was much better. So I asked the physician when he came in next time, I said, "What did you give her?" He said, "It's a nervine." Okay. So skullcap is an excellent nervine. And so I started adding the skullcap to the California poppy, the Jamaican dogwood, or the wild lettuce. And it works very well, even better than just these on their own. And sometimes I'll use them synergistically. Some people, the California poppy, Jamaican dogwood, and wild lettuce works better synergistically. You just have to work on that and see what works best. And that's the above ground parts. It's good for aches, for bedwetting in children, bladder disease, calming, depression, insomnia. Just like wild lettuce is good for insomnia. It calms. Liver disease, long-term mental and physical tiredness. There you go. Might help some of your patients with mental issues. Melancholia, mood swings, nerve pains, nervous agitation, neuropathy, organic neurosis, pain. It's good for relaxing, sedation, stress, vasomotor dysfunctions, and weather sensitivity. What's weather sensitivity? There are people who have sensitivity to changes in weather. And so it's good for those people. Health risks or side effects following the proper administration of designated therapeutic dosage are not recorded. Catnip. What do you think about catnip? What do you use catnip for? Oh, catnip's, yeah, you can give your cat a fun time. What? What? A tea? Okay, what's it good for though as a tea? Colic? Calms the nerves. Helps to sleep. Croup. It's also good for tummy aches for both adults and for infants. But it's very, very safe to use for your infants when you're dealing with croup, colic, a stomach ache, or difficulty sleeping. And you can share with the cat every once in a while. Acute bronchitis. Acute bronchitis. So let's see. Asthma. Blood pressure. Why blood pressure? It calms. Yeah. Yes, it calms. Cancer. Can you imagine? Just catnip is good for cancer. Cataracts. Chicken pox. Colds. There's your colic. Decreases cigarette desire. Decreases cigarette desire. So if you have a person who's wanting to stop smoking, encourage them to drink catnip. But not too much in the daytime because it can cause what? Sleepiness, and people need to work. So you can use lobelia, and if you use lobelia, many people who smoke, the lobelia makes the cigarette taste bad. Now, this is what you can do during the daytime. It's called Smoker's Blend. Smoker's Blend. It's got 3/4 of a cup of lemon juice, 1/4 of a cup of honey, and 1/3 a teaspoon of peppermint essential oil. It's phenomenal. Works very, very well. As anytime you get a hankering, y'all know what a hankering is. Desire for a cigarette. You take a nip. Y'all know what a nip is. Just a little sip. So anytime you get a hankering, you take a nip of the Smoker's Blend, and it will cut the craving for the cigarette. I found that it's also great for when people are trying to quit drinking. We also even use it for people who are trying to get off drugs, even cocaine and those big drugs. I found it to be beneficial helping with those people. Yes, 3/4 of a cup of lemon juice, 1/4 a cup of honey, so you've netted a cup so far, and then you add just 1/3 of a teaspoon of peppermint essential oil. And they just take a nip anytime they get a hankering.
How much do you take?
Pardon?
How much do you take every time?
A nip? Just very little.
So finish the 1 cup per day?
No, it's going to last. It's going to be there for several days. Because they're not even taking a mouthful like you take with a glass of water. Just enough to, a nip. A nip is just a, y'all need to come down south. We'll teach y'all what a nip is. Maybe a teaspoon. Yeah, maybe a teaspoon. It's very little. Yeah, very little. No more than a teaspoon. They don't want more than a teaspoon. Diarrhea encourages menstruation. For menstruation, the best thing I found to fix menstruation is nutrition. We get girls at the college local college, they'd quit mincing. And we would get them juicing, just vegetable juice. And within 30 days, boom, the cycle was working again. And what was their problem? They're eating ramen noodles. You know what college life's like. You don't have any money. They were also just stressed to the max with school. Stress affects menstruation. Poor nutrition affects menstruation. And so we found to stabilize hormones, just juicing is very, very big. And even young ladies that can't get pregnant, we found that juicing to be very beneficial in helping them to get pregnant. And you're doing two things there, three things. It's a great detoxer. You're stopping the bad stuff from going in, and you're providing the good stuff, a lot of nutrition. And we found that in just 5 weeks, a person we had one lady, we've helped numerous ladies, but one lady, she'd been 2 years trying with different infertility experts in Knoxville, and she just couldn't get pregnant. And in with her 5 weeks, she was pregnant. And now, did the juicing get her pregnant? God blessed the juice, and she was able to get pregnant. Fevers, flatulence, flu, headaches, hemorrhoids, hiccups, hives, induced childbirth, insanity. There's a bunch of that needs to be drank. Jaundice, liver problems, lung problems, measles, mosquito repellent, nerves, nightmares, overexcited children, reduces swelling, scarlet fever, scurvy, sleeplessness, smallpox, sore breast during nursing mothers, stomach aches, toothaches, tuberculosis, upset stomach, vomiting, whooping cough, expels worms, and yellow fever. Now look at all that stuff there. And, okay, so let's go here. I mean, that's a lot of stuff, including cancer. Look at all those. That's a lot of health problems. No health hazards or side effects known in conjunction with the proper administration of designated therapeutic doses. Is God good? He is. Well, let me share how you can find this. There's a couple resources that I encourage you to try out. Go to YouTube. Go YouTube/lifestyle to health. YouTube/lifestyle to health. And I've got some videos up there. We're going to be putting a lot more of our videos up there. This one is not up there yet, but a lot of them are. The whole Old Mountain Remedy series, that whole series is up there. You can go, another way you can learn some of this is go to Facebook. Go to Facebook, Mustard Seed TN. And I know some of y'all watch that. Mustard Seed TN. And on Wednesday mornings at 7:45 Eastern Time, I do a live on there. And this week was allergies. I missed a week when Mary Lou had some problems 3 weeks ago. Sometimes I may not be there if I'm out on a fire call. But so Wednesday morning, 7:45 Eastern Time. Y'all are Central, aren't you? Okay, so it'd be 6:45 your time. But you can watch it later. And you can watch those. Also, you can go to themustardseed.us. Themustardseed.us, and that's our website. And tomorrow, these here will be on DVD that will be available. But you can go to, you can also find things on Amazing Discoveries. Barbara's, y'all watch Barbara. Have you had Barbara here before? Barbara's a really good resource, Barbara O'Neill. She was down in Chattanooga at Collegedale filming, again, within the last week or two, another series for AD. But so there's several resources that you can go to. But tomorrow I have this if y'all want it. Any questions on this before we take a break, and we'll come back at 4 o'clock? God has given us natural remedies. And let me share just a quick story. My great-granddaddy told me this story. At 70 years old, he went to Chattanooga because he was having kidney failure. He was a veterinarian. So he went to the physician in Chattanooga, and the physician said, "Doc Smith, there's nothing can be done for you." They didn't have dialysis back then. He says, you're in full renal failure. Just go back home. There's nothing can be done. So Granddad went back up on the mountain. He was a farmer. He was a veterinarian. And he started drinking corn silk. And he told me the story himself. That he was 70 years old. Granddad died at 105 and a half. And the corn silk just totally eliminated the renal failure with God's blessing. Granddad worked for Kellogg up at Battle Creek. He was a nurse before he went into veterinarian work. And he learned a lot from Kellogg using herbs and fomentations and that kind of thing. So God has given us these natural remedies. You look in the Bible, the fig, the hyssop and different things that He used. Look what our grandparents used, our great-grandparents used. Look what the Native Americans used, these natural herbs. And God has put those phytochemicals in there, and they're extremely powerful. We just need to do our due diligence so we understand physiology, along with understanding then also the aspect of how the herbs work. And I believe we can get rid of a lot of different kinds of medications and the side effects of those medications if we do our due diligence and ask God for blessing. Let's pray. Our dear Heavenly Father, Lord, thank You for giving us these foods that can provide nutrients to our body. Lord, help us to use them, but still also remember we need to follow those basic laws of health and not ignore them also. Or not ignore them, because those are the foundation that You've given us. And not to substitute the herbs for those, but to use in addition with those. Give us that desire to learn Your natural ways. And Lord, bless as these folks apply and use them on their families, themselves, and their neighbors, and those they come in contact with. We ask this in Jesus' name. Amen.